Well, good afternoon, everybody. Thank you for joining us today. We have a distinguished panel of guests joining us today to talk and commemorate about Men's Health National Month in the month of June. So we'd like to have a conversation today about men's health and all things we can do to help men get healthy in Washington State and beyond, and make sure that we put our health as a priority in men's health. So today joining us, we have Reverend Dr. Leslie D. Braxton. We have Dr. Daniel Kaminsky, Doug Baldwin, former Seahawk, and Dr. Umair Shah, the Secretary of the Department of Health. We're going to go around the room today and have just an introduction session to start out with, and then after that, have some kind of questions and have discussion. It's a really casual time to really discuss and share some information and thoughts around this important topic as we finish out the month of June and move forward into our summer months. So I'd like to start today with Reverend Dr. Leslie D. Braxton. If you would take a couple minutes to introduce yourself, I'd be very welcoming.
Well, first of all, I'm glad to be here and be a part of this webinar. I am from the city of Tacoma, graduated University of Puget Sound, went back east for 15 years for graduate school, then working, and came back in 1999. I pastor the New Beginnings Christian Fellowship Church in Kent now for the past 16 years. And I am married for 33 years to Sheila Braxton and have two children, Carissa and Samuel, both graduates of HBCUs, and health is a very, very, very important part of life, because without it, you don't have life. So I often say to people that from a religious perspective, anything you do for God, you're going to do in this body. So you can't even think in terms of religious goals and objectives without saying, I've got to be concerned about my health, because once that fails, all other plans cease.
Well, thank you. Wow. 33 years. High five for that one. That's good. Good job. Well, thank you for joining us, and I look forward to hearing more from you today. Second, I have Dr. Daniel Kaminsky. He's a public health officer and medical director from Walla Walla. Hello, please introduce yourself.
Yes, good afternoon. I am Daniel Kaminsky. You mentioned that we have a distinguished panel of men here, and I was looking at the screen, like there are distinguished men, and then there's me. So I do feel humbled being around some great men, and I'm looking forward to learning from all of you. I live in Walla Walla, Washington, with my wife Jane. I have adult kids that are moved out of the house. I was in women's health for 20 years. And now am happy to serve my county and my state in my public health role. So thank you for letting me be a part of this.
Thank you. Welcome. And then many of my Sundays are watching our next guest, former Seahawk, Doug Baldwin. Please introduce yourself. Welcome.
Yeah, I guess iterating the same thing. Well, first and foremost, I think I need to have a reverend or doctor in front of my name. I got to get that taken care of. But same, just really grateful to be part of this conversation. I think what I bring to the table is just an experience that not a lot of people have, and especially as it pertains to mental health, emotional health. And then I am also a father. I've got a 2 and a 3-year-old and one on the way. So my wife is pregnant now. So my mental health is very important to me in a lot of regards, but just really grateful for this opportunity to speak to you all and learn from you all as well.
Thank you. Welcome. And last but not least, of course, the Secretary of Health, Dr. Umair Shah, for the Department of Health. Please introduce yourself. Welcome.
Thank you. First of all, Greg, thanks for agreeing to moderate. And it's going to be a lively discussion. You're going to be herding some cats, I'm sure, in terms of a number of different directions we'll all go. But it's great to be on this panel with the great Reverend, obviously Dr. Kaminsky, a wide receiver great, and a leader in his own right. I think all of us can recognize the absolute importance of this topic for not just us, but also for the people around us. So Umair Shah, I'm the Secretary of Health of the great state of Washington. I'm a physician, ED physician for 20 years at the VA hospital in Houston, originally from Cincinnati, grew up in the Midwest, found my love in public health, where the community is our patient. but also still very much appreciate the importance of individual healthcare and why we need to work together, public health and healthcare delivery. Have gone through a very tremendously challenging time with our team for all of us, which is that in the midst of being on the front lines with COVID-19 response in Houston for the first year, Governor Inslee asked me to be the Secretary of Health for this state in December of 2020, and it has been a blur since then. It was about 4 or 5 days after vaccines arrived in the state, and the last year and a half have been all about how we protect Washingtonians. And so it's great to be here today. I'm glad we're talking about things that are not just COVID-19, but really how do we look beyond that for health for all of us. I'm a father, husband and father. My 3 kids, one a 12-year-old daughter and an 8 and 5-year-old sons, and hopefully one of them doesn't walk in the middle of this. And if that is the case, I may have to turn the camera off. Great to be here.
Well, thank you. And I can neglect to introduce myself. Greg Endler. I work for the Department of Health. I'm Deputy Director of Health Promotion Education. I am as well a father. I have the first day out of school for both my boys, 12 and 7. So I may also have the same situation. I've tried to lay the law down, but we don't know what's going to happen. Whenever you lay the law, it just turns a corner on its own. So we will make it through. This will be a fun time. So welcome. As for everyone that's watching us today, this is an interactive process. So if you do have questions, comments, ideas, please drop it in the chat box down below. We may not answer all of them. We may not get to yours, but we may get to others. And that's okay. This is interactive. We do have some questions that we've already get ready to toss out, but we also will take questions from you as well. So please drop those questions in for us. So let's kick it off, this conversation. So gentlemen, here's the first question. What do you feel is the biggest issue impacting men's health right now? And anyone can just jump on in.
We're being nice, huh? Everybody wants to wait.
I'll break the ice.
Thank you.
So when I think of what's affecting men, it's like looking in a mirror. I'm obviously a man, but I think about my habits and whatnot. But most of my health issues and most men's health issues, I think what enters our mouth. The foods that we eat. Alcohol, drugs, and nicotine. So that was just my initial thought of a starting point for physical health.
I would add, in addition to just lifestyle and habits, which Mr. Kaminsky just stated, it's moving from being reactive to proactive. I think women are far more intentional because they tend to be the nurturers in our family, looking out for everyone. And that starts with a self-consciousness that I need to get my physicals, my checkups, everything at certain ages have done. And men, we tend to not go to the doctor and wait till something happens. And then we're behind the game in terms of early prevention and all that thing impacts life expectancy. So it's changing the mindset of men with the false sense of invincibility. I think it's a byproduct of overall toxic masculinity. We've got to move from being reactive to proactive in our healthcare, combined with healthy life habits.
Well said.
And I would just add to that is that we know that heart disease is the leading cause of death in men and so important to men and women in terms of prevention. But it really gets to how do we raise the awareness and make sure that people recognize that, not to steal from Doug here, but that we're all in this game. And we all are invested in our health and the health of the me's of the world really impacts all of us around us, our families, our partners, whether it's our kids, whether it's our neighbors, whether it's community members, people at work, people we go with for faith service with. It impacts all of us. And it's really about raising the awareness that we're a part of that as well. And we need to take care of our health so we can be the most present for everyone around us.
Yeah. I mean, I definitely agree with everything that everybody said, but I think maybe because I'm in this moment of life right now, I'm in therapy, evaluating just childhood trauma, is what it really comes down to. I don't think we talk about that enough. I don't think we talk about the childhood trauma that everybody experiences to some degree, but obviously males and Reverend, you spoke about just the differences between how people approach different aspects of their health. I know for me, growing up in the South, and men in general, usually we don't have this this desire to go do mental health. We don't pursue it. And so for me, just diving deeper into the mental health side of things, that obviously coming out of my previous career, there's a lot of things behind that. But then diving into my childhood trauma, and not to get too personal here, but not just childhood trauma as an umbrella, but like actual sexual trauma. We don't talk about that enough. And I'm sure, doctors, you guys know this, that there is a lot of sexual trauma that happens that it's way more prevalent than I think we care to admit, and actually addressing that, being honest about that, and then obviously being vulnerable enough to discuss it and to address it. I think that's where we're missing a huge part of this element of mental health and societal health in general. So that's what I would say.
I think Doug really put his hand on something extremely sensitive, and as a pastor, and I don't mind saying, I've been in therapy a couple of times. Most denominations are requiring that clergy take therapy as a regular regimen, because when people dump their problems on you, you tend to internalize them. But we're human beings who live the same course of life. And boys are almost as likely as girls to experience child sexual trauma. And because of the sense of not wanting to be weak, men are far less likely than women to admit child sexual trauma. A lot of the things that feeds our toxic masculinity, our own predatory behavior that develops later on, is because we internalize what has happened to us. The thing that drives men's addiction habits are people self-medicating because of unresolved sexual trauma. And in fact, it would shock most people to know that right now sexual addiction is moving at more rapid rates than any form of chemical addiction. Yeah. And there are some high-priced private programs because health insurance doesn't cover it under mental health care. And so when you look at pornography and it costing people jobs, resources that is needing for rent and other sorts of things, that people can't afford the high-priced programs for men to deal with sexual addictions that are simply symptomatic of unresolved child sexual trauma. So you have really put your finger on a holy grail that has been, it's a quiet riot that's been going on.
And then how do we look at that as being,
we're gonna just need and just help moderate if you're not speaking. If you just place yourself on mute, we're getting a little bit of feedback from computers, so it's okay. It happens. This is part of the pandemic. We've done this a long time. So, Omer, please go on.
Well, I just wanted to say what both Doug and the Reverend just said is absolutely spot on. It's truly, how do we not just look at health and wellness from a today, where we are today standpoint, but really dive into what has contributed to how we got to today. And when we get back to childhood, and we go back to those experiences, we go back to trauma and all of those activities that we have experienced, we have witnessed, that we have seen, that we have been a part of, to look at all of that as a summation of where we are today. So a lot of times what we do is we talk about today, we talk about the future, but we're unwilling to look at the past. And if we are not honest with ourselves to be able to look back at the past and where we are, where we've been, how we got here, then we really truly cannot get us to where we're going.
And just honestly, as someone sitting here watching a conversation, mad respect to even touching this topic, bringing it up and discussing it. This is, thank you, Doug, for taking us there, and Leslie for adding, and Umair. Mental health is men's health. And I think that's a really important piece, is like, we always think physical health, like, are our bodies okay? And we don't do that very well either. But mental health, we sure as heck don't do it. So thank you for bringing up that very vulnerable topic and saying even, hey, I'm going to therapy and it's okay. I'm working on making myself better.
Yeah, and just to be I mean, this is Men's Health. So I think the only way that we actually get to some solutions, have a real conversation, is by having a real conversation, right? So I am actively in therapy, and I'm sure the doctors can appreciate this. I'm about to go through the next stage of cognitive behavior therapy to start rewriting some of those narratives that I've been telling myself subconsciously for years and years and years, right? I think that all of the symptoms of our society that we have been seeing play out, not only because of the pandemic, but even prior to the pandemic, a lot of this, at least from my perspective, and I could be naive to this, is the fact that we don't talk about our childhood trauma. Like, it is not, we have normalized childhood trauma. We've normalized sexual trauma. And all of you've already mentioned it, like, there are so many aspects of that when you don't unpack it, they manifest themselves in so many other ways, right? Like, pornography is one of them that I know all too well, right? Like, if you don't address the underlying condition or issue of why that is the case, and Reverend, I'm interested to hear your part of this, because I am also a very spiritual human being. So I'm a Christian. I believe in Jesus Christ. And when I say that, I know it's not always the right space to say that, but I say that in this context. Jesus said, love God with all your heart and love your neighbor as yourself, period. Doesn't matter your sexual orientation, doesn't matter where you come from, doesn't matter your color of your skin. If you're a neighbor on this planet that's tumbling through space, love that person as yourself, period, right? That's what I believe. But I think all of the symptoms of pornography, attention, false attention and affirmation pursuits, all of this comes from us trying to find true love, right? Like, that, at least that's from my perspective. We're trying to find this element to fill the void, and all of these other things we're trying to fill it with that never suffice. And we're always challenging and charging to go find another, that next high, right? And I think a lot of that comes from the childhood trauma. If you don't experience that love, or if you're in an environment that's unhealthy to that then, obscures your view of what love is, isn't that what we're seeing in the world? Because if let's put it in a math context, if everybody loved each other like they love themselves as a neighbor on this planet, we wouldn't have a war in Ukraine right now, right? If that was the case, and this is a topic that I'm readily on top of right now, this is something that's on top of my brain. How does somebody come up with the idea to enslave another person? What level of depth of trauma and issue do you have to have gone through to think that I'm going to put that person through hell, another human being, right? And I'm connecting this all through childhood trauma. What happened in somebody's life prior to them making that decision to do something that we all are like, how the hell did you come up with that decision? And instead of being negative and judgmental and really harsh about that person and that decision, I'm trying to get back to a place of empathy and grace and say, I don't understand it, but from a childhood traumatic experience, personal perspective, maybe there's something there. But I'm just throwing that out there. I'm curious to hear what you guys think about that.
I think that was, you tossed it over to Leslie, but Leslie, please chime in. And then after that, I would love to hear Daniel, what your thoughts are as well. But Leslie, please.
Well, Doug touched on a lot of topics there. I would say that one of the mistakes we make in our society is thinking children will be okay. And we tend to associate trauma with adults. And they say trauma is a tragedy that you went through by yourself, that you didn't have anyone to talk to. That's why when there's mass shootings, we get in and have people talk to folks right away, because that affects how the brain responds to it, and then how it begins to push subliminally, subconsciously behavior. And kids have gone through trauma where no one talked to them. They said they'll be okay. And they're not just okay. I am a 60-year-old man who still has nightmares. At least probably about once a week. I used to have them almost every day. Used to wake up in the morning. My wife was downstairs in another bedroom. And I would ask her, why are you sleeping downstairs? She says, no longer safe in our bed because you woke up, fists drawn back, getting ready to hit me. And I knew you were dead asleep. And it's because I grew up in a home where there was an undiagnosed PTSD, Korean War veteran, a stepfather, who, when he drank, he would assault everybody in the house, starting with my mom and my brother and sister. And I my first concussion did not come on the football field. It was when I was slung up against a wall by like a sack of potatoes at 6, 7, and 8 years of age. So the childhood trauma unresolved in a poor Black family, there was no therapy. And so you walk around with a hole in your heart. African Americans, an overly traumatized community, walking around with holes in your heart. And so you're right. I think with men, one of the problems in dealing with is a sense of shame. And I keep talking about toxic masculinity. If our definition of what it means to be a man does not leave room for admissions of hurt and pain, and certainly if you let something sexual happen to you, then you clearly are not a man. So as hard as it is to get women to make admissions so they can get help, it's doubly harder, if not triply harder, to get men to make admissions of the kind of violations that are now shaping behaviorally how the rest of their life. And so I think by creating a space, by redefining masculinity, I mean, think about it. Who's doing all the shooting in our society? Women are 52% of the population. Men are almost 100% of all of the shooters, whether they're Black, white, Asian, Hispanic. We've seen of late the problem of shooting in our society, it's men. The majority of suicides are men using guns. So we are at once homicidal and suicidal, not because we experience more trauma than women, but somehow or another, the way we define our masculinity, we don't have the coping mechanisms that women do, so that women go through as much or more trauma, but process it in a way in which they're less likely to harm themselves and less likely to turn it on others. So I think we have to talk about masculinity and trauma. And what is it about our Western ideal of being a man that does not allow us to make the kind of admissions that allow us to work through so we get to a point of healthy self-love? Because if I don't have a healthy self-love, that's the pot out of which I offer love to another. If I hate myself or I'm ashamed of myself, I have no psychological space to authentically love and affirm another human being.
Wow. Just wow. I mean, this conversation is blowing my mind because you're hitting some major points that are just, I can hear, or if the men watching, if the men are hearing this across Washington State and beyond, ding, ding, ding. These are things that are impacting multiple men's lives. So thank you for both for sharing that. I mean, Dr. Daniel, please, from your perspective, please share with us. And then I have a question for Dr. Shaw, but please.
I think your wow is a correct statement. I mean, I'm learning, sitting here learning a lot from Doug and the Reverend and how they can put words and help frame this and explain this. And I'm sitting here thinking, my goodness gracious, I'm getting flashes in the back of my brain that I've been in denial too. I mean, I think having this conversation, we need to do more of this. It could change lives to have these conversations. And so I don't have anything smart or eloquent to say. I'm just going to keep sitting back and listening and learning.
I think just having your own aha moment is huge. I mean, all of us, I think I'm sitting here thinking through my own history, real scan back real quick. It's like, wow. But Dr. Shaw, I mean, thinking and listening to this kind of collective trauma that's been happening, what do you feel that the impacts are on public health? I mean, we heard some of it already, from shootings to addictions to stuff. Can you give us a public health perspective on that as well?
Well, yeah, I mean, I'm trying to recapture my thoughts as well, because that was so powerful. I think one thing that I wanted to elevate is that we talk a lot about the individual, the person that's going through. We've got to be able to figure out a way to understand that this is a systematic process, that there are societal forces, there are societal waves that are occurring where we are caught up in that. And so whether it's what we do or how we act or what we see or how the world is, how we view it, or what's happening in our families, what's happening in our neighborhoods, it is about society. And when we look at populations, when we look at people, when we look at the society, that's when we start to have, what can we as society do that thereby is going to help the individual, But we can't just stop at the individual. We've got to look at this from a societal standpoint. So when we encourage communities to be healthier, oh my gosh, how much impact is that on the individuals in those communities? But we forget that, right? And then we have the Dougs of the world and the Reverends of the world, or the Umairs of the world, or the Daniels of the world or the Gregs of the world that are trying to figure it out on their own, because we have failed to do enough for our society, and then to turn around, we're not doing enough for our next generation. All of us have talked about those kids that we have, whether they're grown or whether they're still, itsy bitsy babies that are just growing to the next level. We have an inherent responsibility on what is it that we are going to create for the society that we want them to be a part of, to lead in, to live in, to be a part of that. And what are we teaching our sons? How are we teaching them? What are we doing to prevent them from reliving trauma that we ourselves have lived? When we're watching mass shootings in Uvalde and Buffalo and Tulsa, and you name it, our kids are going through trauma every single day now. And what is it that we as society are doing to take that on? So when we talk about this, Greg, it's really about society as well as the individuals. Shame on us if we do not and cannot and will not do more when we know those very things are impacting the very people that all of us care about, and especially the next generation. So I'm not sure I've elucidated anything from a public health standpoint, but what I will say is that from a men's health aspect, we know that men are dying younger than women. We know that it has a lot to do with not just our genetic code, it has to do with our zip codes. It has to do where people live, where they learn, where they work, where they worship, where they play. It happens in the community. And shame on us if we do not build stronger communities, healthier communities, communities that have well-being in mind, resilience in mind, strong communities. That is not about, the communities that have the resources, but it's all of our communities. I'm coming from an immigrant background. I come into this country. My dad arrived in 1960. It was about Black America, white America. He shows up. People are like, who are you? What do you have to contribute to our society? This is what we have collectively done to people coming into our communities, is that we have somehow defined others versus us, when it should be about all of us.
You put your finger on something, the economics of health. The economics of health. It costs more money to eat healthier than to eat poorly. Poor people tend to stock up on empty calorie food, carbohydrates, and so forth. It fills your belly. It has little or no nutritional value. Fruits and vegetables cost more than belly fillers. And Black folks have been filling their bellies with the throwaways that white folks didn't want to eat because that's all it could afford. So we've had junk coursing through us for 400 years now. People live in communities where there's food deserts, where you got rotten meat at a corner store at 2.5 times the prices than in a supermarket. And because of their address, they can't even get to where prices are lower, quality of food is better. All of those things contribute to disparities in health, lack of health care. We just got an Affordable Health Care Act that most of the people who ironically call themselves pro-life are against healthcare being a right, but a gun, which takes lives, being a right. Try processing that in your mind, the hypocrisy of people calling themselves pro-life, but every political and public policy decision they make threatens life that is sacred for 40 weeks of gestation. But as soon as you're born, life has no value. And our public policy is anti-life at every point. And so we've got to ask ourselves as a society, are we going to make healthy living possible? I mean, right now, our lack of health, we have an obesity crisis in American society in general. Obesity is defined as only 35 pounds over a healthy weight for you. Only 35. We tend to think of obese as super obese. At 35 pounds of excess weight, every system in the body is compromised, from your respiratory, your circulatory, your cardio, your digestive, your skeletal. Every system of life is compromised by 35 extra pounds of weight, let alone 60, 70, 80. And among your minority communities, Black and Latino, it's even worse. There is a national defense implication of this. 60% of our young people can't even qualify for military service because they're obese. They can't pass the fitness requirements. And when you consider China has 1.3 billion people, we have 300 million, little more. They literally can spot us 1 billion people, see us in a conflict with China, and they've got 1 billion more people to start from. And our 300 million is degraded because 60% of our young people can't even pass a fitness exam. And then from a public policy, we took recess and PE out of schools, and we brought fast foods into schools. So we're blowing up our kids. We're not giving them exercise. And we think we're going to be globally competitive with a shrinking life expectancy and bodies that can't walk around the block. I mean, we're becoming more unhealthy every single day. And our public policy does not match our rhetoric. What does it really mean to be pro-life from a public policy standpoint? Because from my perspective, we are aggressively pro-death and pro-sickness.
Again, wow. But Doug, please go ahead, chime in.
I mean, just, I guess my question, I don't even know if it's a question, but, and again, I want to qualify this as that I'm not a doctor. So this is not my expertise, but this is just, you know, as I'm hearing this conversation, just what I've been thinking about in general. So you talk about the economics, Reverend, and I can't help but think that, like, that's the thing that's more important. It's the economics, you know, and we know this from a capitalistic standpoint. Like, that's what stands capitalism on, stands it up, is that it's, you got to have a competitive nature about the society in order to generate more money. If you, it's simple supply and demand, right? Mm-hmm. And I guess from a public policy standpoint, and this is what I'm trying to inject into my company and how we operate, is that I don't care about the bottom line. The bottom line should not be the end all be all. The return of investment is, are you making an impact for the good, for the positive in the community and in society? And I think the problem that it's going to proliferate for, you know, as long as it has and as long as it's going to, is just, we don't necessarily look at human beings as human beings and taking care and loving them as human beings. We look at them as vehicles for production. Essentially what it is. If I can keep you at this scale to focus on production at this level, it's good for my bottom line. And I can't help but think, you know, I don't want to be one of the, I'm not a conspiracy theorist. Just let me be very clear about that. But I can't help but think there is some commonality with the fact that our entire system of government, our country, was set up in this way at the beginning. So there, you know, I'm not saying that it's as relevant now. I think we all are clear that there are some issues within our government system and our systems in general that need to be addressed. But overall, like, there's an umbrella effect to this. If you start off with the evil intentions that this country was built off of, and I can say evil intentions because I don't think slavery in any capacity, any mindset would ever think that that's an okay thing. So in this evil setup, like, there's obviously going to be generations and generations of systems and ideologies that are passed down that then affect every angle, every facet of public policy. And to me, again, Reverend, this is why I keep bringing it back to you. Like, I think about this from a Christian standpoint. If there's not love and empathy, then what is it?
Well, again, you know, as a Christian man, my biggest fights are with Christians who have an understanding of the kingdom of God that is completely irreconcilable with the teachings and the example of Christ, who put love as our key value. And most of the people who bought the slaves, branded the slaves, raped the slaves, castrated the slaves, divided the families of the slaves, wore crosses around their neck, carried Bibles in their hand, and about whom my foreparents said, everybody talking about heaven ain't going there. So I don't trust anybody because they say they're Christian. I look at how you vote, because your voting and your economics tells me what you really value.
Yeah.
That's what and so I want to get back again to this economic thing. This economy in 2009, Jeff Bezos was worth $4 billion. Today, he's worth $350 billion. Zuckerberg for Facebook in 2009 was worth $2 billion. Today, he's worth $178 billion. The economy that we have allowed a man to go from 4 to 315 billion and another man to go from 2 to 178 billion. The minimum wage in 2009 was $7.25. In 2022, it's $7.25. That's a little over $15,000 a year. At $15 an hour, it goes up to a little more than $32,000 a year. Try living in Seattle for $32,000 a year, and you understand why the higher our business fires and the beautiful landscape of Seattle goes up, the higher the buildings fires go that seem to scrape the bottom of the heavens, the more tense at the streetscape. And so, you know, record corporate profits that allow people to go from wealthy to the wealthiest group of people in the history of planet Earth, and yet they say we can't move the minimum wage from $7.25 to $15 an hour, which only lands you at $32,000 a year. And with 2 wage owners in the home, that's only $64,000 a year, which you can in no ways live in the city of Seattle. You got to move way out and commute in. Throw in the gas prices, you are still the working poor. You're going to need to be on free or reduced lunch. You're going to need some public assistance for your health care, because you're probably going to have an employer that doesn't provide benefits. And now you're into the syndrome of trying to buy what's the cheapest, not the healthiest, being reactive, not proactive in terms of your health care. So we've got to look at the economics of America, because the economics of America have always been inhumane. And until we address the economics, your outcomes are not going to be different. What you put on the front end is going to determine what you put on the back end. And I keep saying to people who claim the same Christ as I do, when are your economics and your public policy going to catch up to your lip service? Because I serve a Christ who said in Matthew 15:8, you serve me with your lips, but your heart is far from me. And I would add to that, your voting record and your economic habits are far from me.
If I could just build on that for just a moment, Reverend, you said it earlier, and I want to make sure that we hit on this, which is then you get into the health system, and we call it a health care system, but we know that it is a disease care system. Mm-hmm. We're not investing enough in the upstream prevention and the true causes of ill health. And so we have a repair shop then in the healthcare system, which is disease care. When somebody gets sick, somebody gets injured, and we repair. And in fact, public policy wise, 95 to 96 cents of every dollar that's spent in health in America is spent on that disease care system. And we struggle then when we're fighting a pandemic, or we're fighting obesity, or we're challenged by environmental issues. Why are we not preventing enough? It's because we're not investing enough. And our policy decisions every single day are about disease care and how do we repair, and not about how do we prevent people from getting sick or injured in the first place. So just taking it one step further, that's the challenge that we have as well.
So, I mean, this is a very, honestly, CMAC Watch, it's a very intense conversation. So I'll just call it out as what it is. And knowing that Men's Health Month, trying to draw it all, we have structural issues, we have policy issues, we have prevention, we have disease control. I mean, there's all these different topics, but knowing that men in general, from the trauma to adverse childhood experiences to masculine toxic masculinity, sorry, flip it around there. All these different things are flowing. We don't take care of ourselves. We don't do it. We don't do the things that need to be done to keep this vessel healthy and this vessel healthy. So knowing that we have allies out there, whether other men or women or anyone else that would like to, advice would we think we need to give to help bring that man along, or help bring the health and wellness into our priority set for men to make those healthy changes? Any thoughts around that? What advice we'd give?
I think we always have to work at different levels, because if we're not empowered on one level, we are always empowered on the most basic level, and that's personal choices. But we have to understand the nexus between personal choices and public policy. It's not either or. It absolutely has to be and in both, because you can't have, in the long run, you won't have healthy individuals in a sick the public policy. You just won't. But I would say this: we as individuals, to the degree that we can within the limitations of our resources, make healthier choices. A mother with children is not gonna not feed them. She's like my mother used to have us take regular milk, mix it with powdered milk, and she would whip us something terrible if we drank that milk straight without putting the powdered milk in it and the water to stretch it. Because with 5 kids from 2 busted marriages where both husbands went to prison, she had to stretch everything. And so people need to make healthier choices within the reach of their economics. And that's an education process. What are the ways in which you can shop to be healthy, because people don't know how to shop, and then make healthy meals within your economic reach? And we need to teach that scalable to people's income. Then, if I don't have healthcare, can I sign up for Obamacare so I can start moving to proactive care? So you have to give people the consciousness of it, and then give them the tools. Because as a pastor, I deal with people every day who say, I don't have a job, so I can't get healthcare. I talked to a 45-year-old man the other day, said, you are way too old to not be having annual checkups. Colon cancer, prostate cancer. At 45, you have to have these things checked. And got him to know when's the next sign up for Obamacare. So we have to educate people at the individual level. Then we've got to get with groups who are making public policy, our elected officials. We have to push for broader public policy. Ultimately, this nation has to have a 100% health care as a right, as is the case for all Western industrial countries. That's not socialism. That makes sense. We spend far much more per capita than every other Western industrial capitalist country for worse outcomes. It actually makes economic sense if we actually provided health care as a right, because the money we waste in lost days at work, deductibles, prescriptions, all of that, it affects everybody's bottom line. So I think we have to work at empowering individuals within their reach and pushing for expansions of public policy that allow people to get the health care they have and move from reactive to proactive.
I feel like I'm at public health church, because this is the right message. I mean, this is where we need to go. I mean, just thinking public health too, I'll pivot to, let's go Eastern Washington. Dr. Kaminsky, you're in Eastern Washington, Walla Walla. Demographics are a little different down there. How do we move men in Eastern Washington to take care of their health?
Good question, but I think maybe peer-to-peer is probably the best avenue to reach people. We don't really have high-figured people here in town that can spread the word. So I think probably breaking up into smaller groups and going peer-to-peer. I think if more people like the Reverend can eloquently outline these topics, that would be helpful. But I think just allowing the conversation to happen, and spreading it one person at a time.
Perfect. And Umair, your thoughts on this?
Yeah, it's interesting. Reverend Zahn, I used to make a kind of a comment to my team back in Houston, which was that if I said, eat an apple a day, oh, that's great. Dr. Shah said eat an apple a day. Maybe you'd have one person, maybe my wife might eat the apple a day, maybe, and she probably wouldn't either, right? But if and this was, obviously down in a different context, but if Joel Osteen or Reverend Braxton said eat an apple a day, that is an incredible value to the people that are listening, to watching, to the Sunday sermon or the service at the mosque on a Friday, or what's happening in a synagogue and what's happening in a temple. That there is such a connection of the people we trust. When Doug Baldwin says, I am having this issue, it's not Shah saying this or Kaminsky saying this. This is somebody people are saying, I want to hear that story. So the connectedness of people that we trust and the value of those messages and messengers is so critical to how we move forward. And so there is a limit to where some of us in the health field can go. And fortunately, we have others that are with us that can help guide people. So yes, we can't stop in science. We can't say, here's the evidence. We can't give you all the data and all the statistics and all the charts and all the graphs. We need to be able to tell a story of why it matters, why we want to encourage men today to get your annual checkup, why we want to make sure that people are taking that mental health break, why they're turning off that TV or that 24/7 news cycle or social media, putting the Twitter and the Instagrams and all the other stuff down so that they can actually spend time with those around them. Why we need to tell people, show people, and help work with people so they understand that their health starts today. It doesn't wait for tomorrow or 2 weeks from now when you say, I'm going to stop smoking or I'm going to put the drink down. We've got to do that today, because your future of health starts today. So I think there's a lot that we can do that's really about the steps that we must take today. But we have to remember that it can't be always about the healthcare system or the political system. It's about the people that we trust, the barbershops, the places that we frequent, the people who are our neighbors, the ones who we love, the ones that we hug, the ones that we come together with. And why can we not build that system of being able to work with each other so we can show that light for the future of health? So I think that's where it is. And the other thing the last thing I wanted to say is it's the stress levels. Stress is such a key driver in bad health. So finding ways that we can keep those stress levels, those hormones, down, helps us be more successful when it comes to caring for our health. And we've got to be in that game. If we're not going to be in that game, again, we're going to continue to be on the sidelines. We're on the sidelines. We're not going to actually affect health for us and those who love us. And guess what? We won't be around very long. And the Reverend said that, Doug said that, Dr. Kaminsky, we will not be here long enough to really impact the very people who love us and want us to be around for as long as possible. And that's just so important for us to be able to do this again, starting today.
Two things real quickly. Number one, a good friend of mine, Pierre Crockwell, guy I knew growing up in Tacoma, he was over 300 and some odd pounds. He's a very successful sports agent, entertainment agent, and so forth. I asked him, because I met him or got reacquainted with him a few weeks ago. And I said, how'd you lose all that weight? And he said, I lost 85 pounds and I did it because I was told, drink 1.5 gallons of water a day. That's 12 glasses of water, not the traditional 8. Don't eat anything white, bread, rice, potatoes. And he said, and then walk at least 30 minutes. He said, so I walked 30 minutes, took the rice, the potatoes, and the bread out of my diet. Drank 1.5 gallons of water, he said, and the weight poured off. For him, it was that simple. And he lost all that weight, and he's maintained it years and years later. But let me say this about stress levels. 30 years ago, a study showed that the top 3 professions in terms of heart attack or stroke were doctors, attorneys, and clergy persons, in that order. 30 years later, in terms of stroke and divorce, 30 years later, it is preachers, doctors, and attorneys. What do they all have in common? They care for other people, and people come to them when they're in crisis. People don't come to me to bring good news. They come to me because somebody got locked up, they're in jail, or they found a spot on their x-ray. Same with doctors and lawyers. And so we care for others at the neglect of our own, and it shows up in our health and in our relationships, both of which have to be nurtured. And because we fail to engage in self-care, we become a contradiction to the message we give to other people. So I feel like I have a moral obligation to make some display of at least a healthy attempt at personal care, which means taking my days off, taking my vacations, disengaging, not allowing people to run me 24/7. Because if I look unhealthy, how can I stand up in front of people talking about the abundant life that God wants us to have? If I am aging prematurely because I don't know how to just have a healthy day-to-day existence where I get enough sleep, eat decently, and engage in the kinds of things that help me manage my stress, because there's no taking the stress out of life. It's about, have you developed a lifestyle that allows you to manage your stress?
Yeah, I want to jump in here. I try to keep it short because I only have a few minutes left, but just the stress level thing, when I'm going through my childhood trauma and then reflecting on, what I grew up in my environment, like the immediate response is that I'm really pissed off at my parents, right? Just that's the immediate response. And I think most kids, the young adults, have that response to some degree. But then once I start being more empathetic and thoughtful about what they went through as children, then I get to the level of like the stress level topic. My family, they were always in survival mode. And I think most of us can understand this, but when you're in survival mode, first and foremost, the chemistry in your body is different, right? We know that. Scientifically, we know that. The chemistry in your body is different. And then the impact of that chemistry on your body is drastic in a lot of ways. We know that. But then also from a logistical standpoint, if you're in survival mode all the time, you don't have time to think about your mental health, about your physical health, and all those stomach fillers that the Reverend was just talking about. That's nothing but logistics. It's easier to put that food in your stomach because there's no prepping, it's cheaper, all of the things that we just talked about. So the fact is that, or I shouldn't say the fact is, my thought process here is that the survival mode mentality that we have placed on ourselves, both from an actual standpoint, from being in environments where we actually feel like we're actually in survival mode. But then also, I think somebody mentioned this in the chat, social media and the pressures of society have manifested itself in making us think that we're in survival mode mentally and emotionally. And I think, doctors, you know this as well, right? All of that comes from just this lack of understanding that we're just human beings on a rock that's tumbling through space. And Reverend, you mentioned something that hit me pretty deep to my core, is that you have to present yourself in a healthy nature to demonstrate the abundance of love and joy, right? And the way that for me, I think I've arrived to that point to some degree. But I think the reason why I'm there is because biblically, it tells me that this is not our final destination. This is not home. This place won't be perfect. We will never live in a utopian society on this planet. That's not to be expected. So knowing that information, then what can I expect? And Dr. Kaminsky, this is what I think to be true as well. It is peer-to-peer. But it's also our responsibility as individuals to say, I know I'm not healthy, to be aware of it first and foremost, to acknowledge it, to accept it, and then change our behavior, which, as we all know, is really, really incredibly hard to do. But from peer to peer, it's my responsibility to be as healthy as I can possibly be, or at least be on the trajectory towards being healthier. And then once I'm around people and sharing that process and that journey and being vulnerable with others, they then feel empowered to then share their vulnerability and their experiences. And I know from personal experience that that is the initial starting point of becoming healthy again, right? If you don't acknowledge the problem, you're not going to find a solution to the problem, right? So we have to first acknowledge the problem. And I think there is a level of individual responsibility that comes into that. And I think it comes from conversations like this. Because I know, the conversations that we're having now in the chat, and then obviously the folks that are watching this that aren't in the chat, they're going to be thinking about things differently. They may then go talk to their friends and their neighbors and their children and have a different perspective and use different language. And we may not see the fruit of it now, but that difference and that change, it happens generationally, right? Like I think about my grandfather on my mom's side. He wasn't the greatest human being when he was a husband and a father at that time. And he was 17 years old, lost his dad in the coal mine, joined the military, forged his grandmother's signature to go into the military. There's a whole bunch of trauma there too. So I'm not holding that against him. But the decisions that he made as a grandfather, the lessons that he learned, and the decisions he made to then change his behavior and then change the outcome for me is impacting the way that I'm raising my daughters today. That to me is the solution. It is peer-to-peer. It is actually being empathetic with not only each other, but with ourselves, understanding the core of who we are and why we are, and then having the courage and the strength and the vulnerability to share that with others. And if we do that, I do think we make an impact. But being clear here, I do not think that the utopian society that we hope for, that we wish for, will ever be reached. And I don't mean to be a Debbie Downer on that. I just think that from a biblical standpoint, that is the truth of what I believe. And that also tells me that it's okay, because this is not our final destination. Now, I know I'm not trying to get too religious here, but that's, I got to be true to myself and be honest with you all. To me, it's not about changing the system or decolonizing, which I don't necessarily know if I understand the context in which the person was sharing in the chat. I do agree with it, but I don't know if that's the actual, the goal. I think the goal should be able to share, to create connection with other human beings, sharing that vulnerability, and then grow as human beings together. And I do think if we do that, we can make some small impact for the betterment. And I don't know. That's my last thing. I'll shut up now. Sorry.
Well, no, it's amazing, Doug, that you're. I always want to say you're bringing your true self to this. You're not being fake here. You're being real. And when you talk from your heart, that's okay. Because if it's your religious affiliations or other things, speak from your heart. That's what we're here to do. And I thank you for being so raw and real with where you're coming from. So I, as the moderator, have kind of failed at my job a little bit, but we are going a little long. So I just will tell everybody that's watching us that we are probably going to run a little bit longer. So hang in there with us. But I really want to drop into some questions that we're getting in the chat boxes. Some we will ask and some we will not, because there are a lot of good chat. Most of all, people are commending the realness and thanking you all for being so real and talking about men's health. Again, being Men's Health Month, that's important. So thank you. And you are role models in your own right. But thinking about the question, what was the catalyst for each of you? This is a question that came of us that made you realize health mattered to you as being a man.
I'll jump in and I'll make it quick. Sorry. My wife. So when we got engaged, she forced me to do marriage counseling. And I think we shared this. I was adamantly against counseling because previous nature told me that that was a sign of weakness. And I didn't want to be weak, right? This toxic masculinity that we're talking about. My wife forced me to take marriage counseling. She said, we're not getting married unless you go through this with me. And that was, to me, that was the catalyst of first off, going through that experience and realizing the impact that it had on my life. That was a catalyst for me. And because my wife is an incredible human being, and now that I have 2 daughters and 1 on the way, it is imperative that I am focused on my mental well-being, my overall health, so that I can be everything that my wife and my daughters need me to be for them. And so my wife telling me to go take counseling, that was the catalyst for me.
Thank you. Others?
I'd say for me, it's just personal history. The fact that well into my adult life, after 3 earned degrees, in a vocation like pastoring and in teaching, and yet I'm still having nightmares. So the past was prologue to my professional life. My kids like to play pranks on each other, practical jokes, but they know, don't do it to dad. Don't sneak up on dad. Don't disturb him from sleep and shake him aggressively. He will wake up swinging. And so it's like, okay, I got to find a way to take a repass through my past and calm something still unsettled down in me. And then when I look at my family, the degree of diabetes, hypertension, stroke, heart attack, and wanting to be around when you consider 80% of wealth in America is still inherited. And so for minority communities, we haven't had much in the past because of past discrimination, but the financial legacy we're able to leave or not leave is directly tied to how long dad lives. And if dad dies early, and so at his peak wage earning years, they're cut short, or there's a long convalescence that eats up the resources that could have been passed on because of health-related issues and so forth, then it's impacting every generation. We're creating generational poverty. And now we're stuck back in the same thing. So it was, wanting to, I don't have diabetes and I don't have high blood pressure. I don't know if I'm lucky or if it's just the byproduct of choosing to be healthier and seeing what addiction has done to my family and drugs of alcohol. I just left it alone. I don't fool with it. I'll have a glass of wine every now and then, but I just don't fool with this because I felt genetically I'm dipped from the same pot. And if I'm not proactive and choose to not have certain things as a part of my life, and therefore I don't have DUIs and all the criminal problems that come with it, simply because of these bad habits and how they keep pulling the carpet from underneath your own feet. We got to stop the self-inflicted wounds.
I'll be happy to go next. I guess I'm a little self-centered and selfish, but for me, part of it is I want to feel good. And, self-medicating with donuts or wine may have a temporary boost, but in the long term, I don't feel better. So that's one thing. And then being able to ride the horse as long as possible. And, so you have to stay active. You got to keep moving and keep doing things. Otherwise you can't move and do things. So that's my motivation. And obviously in my position, people in my county, I'm not saying I'm not the center of attention, but I am a leader in a sense. And if I'm living poorly, that doesn't make our department look very good. And our mission is to try to get everybody on board with living a healthy lifestyle. But I'm a work in progress. I'll keep working on it.
Thank you. Emer.
Yeah, I think you just heard it from Daniel right there about this concept of modeling behavior, and I think that has such an important impact, especially those who have. Actually, I think all of us have, but those who have roles that are public. I think all of us have public roles actually in our communities, in our neighborhoods. So I do want to correct myself. Because I was about to say it's only about those who have those roles, but it's not. It's about all of us. For me, it's a combination of yes, as Doug said with his wife about being pushed to be healthier with my wife. It was my mother just passed a couple of months ago. It was very difficult for us. And it was after my father had passed a couple of years back. And so seeing the mortality, if you will, and what people go through at the end stages of life, you see it as a healthcare provider, but when you go through it with a loved one, it is so hard and so raw, because it tests everything that you have learned your entire career. And then your kids, it shows you that future. And so you want to have a brighter future for them. I think if I could maybe be on a positive note, I would say it's probably also gross anatomy in the first year of medical school, because right after gross anatomy, this is probably why they did this. We were doing dissections and they put lunch right after it. And I remember how it changed what I ate. I didn't want to eat meat. I didn't want to do anything that was unhealthy because I had just been dissecting, and I saw firsthand what disease looks like in bodies, and that we're all mortal and that we all go to the same place. And it changed my perspectives on what I was going to take into my body. And I still remember that. I still remember that feeling going to lunch and saying, whose idea was it in this school to put lunch right after gross anatomy? And I'm still trying to figure out who that person was. I'm still trying to chase that person. But I will tell you, it had an impact on me for where I am now. And even today, so many years later, I still think about that gross anatomy and that lunch, just that connectedness and how it changed my view on what I was going to put into my body. So yeah, I guess I'll put that out there.
A cool example. I could see how that would change mine at the same time too. Suddenly I'd be eating salad. So just thinking about all this, then I'm going to kind of take us toward the future, thinking future cast. You're talking to young boys, whether it's your boys, young boys, we're talking about men's health here. And what if you could envision the future and embracing all of men's health values and thoughts? What would that future look like? What would we want our young boys to have as they move into being men in our society? If that magical question is, if you made the magic wand, what thoughts would you have for those boys, future men?
This conversation always crescendos upward, so I'm going to get out of the gate so it can crescendo upward. I think a hope would be to model masculinity as the more vulnerable you are, the more masculine you are, and that's all I'm going to say.
Wow, that's like Brene Brown stuff right there. The vulnerability is masculinity. That's cool. I love that. Thank you. Others?
Yeah, just to piggyback on that, vulnerability is strength. It takes a very courageous and strong-willed and minded person to be able to share the depths of yourself that nobody else knows about. And that, if you look at just out of the surface level, could bring shame and guilt, but really that's just, we put that on ourselves. It's really sharing our humanity is really what it comes down to. So I'm with you, Doc. That's vulnerability is strength. And I know that from personal experience.
I would add just critical questions like asking boys, do you want to be around to see your grandson, granddaughter graduate from college? And do you want to walk up on your own strength or be on a walker or be dead already? Do you want your wife to be an early widow? How much of life do you want to see? And I think those kinds of questions can start affecting some of the decisions we make. And do we want to speak with the same voice as our wives and so forth about how we should eat and be proactive about our health care?
Just adding to all of that, agreeing with my three colleagues, I would say education is health, and read and be educated and learn and know exactly what you are you're putting not just into your body but also into your mind, and that is so critical to our boys. I believe it was Mark Twain. I was trying to remember, but and Doug had said this earlier, so perhaps this falls in line with that, where he said that he, right before he was going off to college, he was thinking about how little his dad knew about the world, and then he came back 4 years later and he was shocked by how much his father had learned in 4 years. It had nothing to do with his father learning, but it was his appreciation of education and being more learned. So I would say it's education at the end of the day, and not just about book education, but it's really truly about being educated. And I think that's the advice I would give to our sons, all of our sons.
All right. Doug, anything else? Or do you already chimed in? I apologize. I got so wrapped into the conversation, I lost track of who said anything and who hasn't. But I am simply blown away by you gentlemen. This conversation we've had has been amazing. We've gone from vulnerability to policy issues, to thinking prevention upstream, to prevent disease downstream, the role of men in church and in work, and find the connection between the two. We have covered a vast array of conversations today, and it's been very insightful. I think, as Lydia typed in the chat box today, that vulnerability is masculinity and vulnerability is strength, and is the antidote to toxic masculinity. And in order to make the changes we want to get to, we have to break through that. We can be vulnerable, and we can actually change our health, change our minds, and then change our society through breaking through those different items. So this has been an amazing conversation. I know we went a little over today, and I thank you all for your time. So Leslie, Daniel, Doug, and Umair, thank you for giving us your insights, your wealth of knowledge. I'd also like to thank Catherine, our ASL translator. Thank you so much. It's hard to keep up with all these words, but you did a wonderful job. And thank you, our audience, for joining us today and having this conversation about men's health, the importance of it. And this conversation needs to continue. So go out there, have the conversation with your friends, your family. At the end of this, feel free to share this recording on Facebook or Twitter. Make sure to get that out there and share that. Important people have important things to say about men's health, and this is an important subject matter. So thank you all again for joining us today. Thank you, gentlemen, and it was great to see you all.
Thank you all.
Have a great day.